Next speaker, she's a practitioner, policymaker, scholar, author, volunteer, and a mother. She's a serving IAS officer for 28 years. She worked in land administration, urban management, rural development, and education. She is also an NNL UNESCO awardee for her work in adult literacy and advisor to the Bangalore City Corporation.
She pursues social advocacy as technical advisor, grassroots research and advocacy movement, MISO, member, advisory panel, Center for Health and Development, Bangalore, and speaker, HER Initiative. She is an alumna of IIMB Bangalore. She belongs to the first batch of PGPPM and then did her FPM.
She is also the principal secretary to the government of Karnataka. God, I can go on and on about her. So without any further delay, I'd like to welcome Mrs. Kalpana Gopalan. Please welcome her with a big round of applause.
Thank you so much. I just came here as a signal for you to stop, actually. Good morning, everyone. Thank you all for this opportunity. Thank you, Pooja, especially for thinking of me. In the last few weeks, we have been in the government of Karnataka. We have been discussing the Human Development Report, which will probably come out in the next few months or so. In the course, I have been trying to attend most of those discussions, and in the course of those discussions, there was a very intriguing remark made by two individuals, both of whom I respect very much. One is Dr. Balasubramaniam of the Gram Initiative, or what was also the Swami Vivekananda Youth Movement, which some of you may be more familiar with. Anybody from Gram or Swami Vivekananda movement here? You know about them. And also Dr. Ravi Narayan, who is from the Center for Public Health and Equity in Bangalore. Anybody from Center for Public Health and Equity? In any case, in the course of the discussions, they made a very interesting observation. They said that the voluntary sector's participation in social service programs, social infrastructure and social services delivery is a disaster. And the voluntary or the NGO sector, as we like to call it, they should not be entering this social sector at all. And this should be solely left to the purview of the government. Now, for me, I have spent 28 years in the IAS, and I've got so used to criticism about the government's role in the social sector. And so this was extremely interesting and amusing to me. And I resolved at that moment that I'll repeat this in every forum that I can address. But this is interesting. Why does the social sector feel? We all seem to agree that government is not doing enough of a good job in the social sector. I am being charitable. Perhaps some of you will be more harsh in your criticism. But then the non-profit sector also feels that this is not their domain. And the for-profit sector is simply not interested. Okay, so what is the way forward? Because all of us do see, empirically we see that there is a huge necessity here. There's a huge requirement. There is a gap, or there are multiple gaps which need to be bridged. But then who is going to do that job, and how are we going to do that? So with that in mind, I am just going to address three questions. Why is social sector infrastructure and service delivery so challenging? Okay. And why are public-private partnerships uniquely suited as a structural model to meet these challenges? And PPPs are my favorite subject, not because I am a blind votary of PPPs. Partly they were my research subject when I did my PhD here. But while being very alive to the difficulties in PPP, I still feel that they are a very good model which we can use in many circumstances. And thirdly, what are the kind of implementation challenges that we may anticipate? So these are the three questions. I'm not going to speak for long. So Let me just get to this business. Now, for all the tasks that we set ourselves in the collective endeavor of nation building, delivery of social infrastructure and services is the most challenging. And what is the reason for this? Why is this so? First is that it is because it takes a long time, a very, very long time. Now, let us take a very simple thing like school education. Even the most basic of social sector services takes a decade at least to provide the most basic of education to our population. So it's a very, very time consuming process, a long gestation process. Second, it involves a change in mindsets and behavior patterns. This is a very, very hard task considering the vastness of the population, the deep rooted cultural and behavioral traditions. It becomes an extremely difficult task. Now, let me take one example. The Karnataka government and other governments as well, they distribute iron and folic acid to pregnant mothers. So, this is one of the programs of the health department in this state and many other states. What we find is that while the ANMs or other health sector workers, they do go and distribute the tablets, the capsules, these are not consumed by the pregnant mothers. Most of the time they are thrown away, they are lying somewhere in the house. In fact, one of the volunteers whom I met, she spoke of huge mounds of this kind of tablets or capsules which are lying in their houses, but they are unconsumed. So it involves a change in the way people behave, which is extremely difficult to do. Third, as in all infrastructure and public goods, there are significant externalities in the social infrastructure and delivery as well. Now, let us take primary health care at the village level. Now, you can provide PHCs in every village within a radius of 5 kilometers. We can set up the infrastructure. But this is wasted effort if there are no toilets for women, or if children are running barefoot playing in the drains. So there are so many things intertwined here that it is a much harder task to provide health care for the population than it is to build an airport or a flyover, which may look big and where the results and outcomes are very evident for everyone to see. But these, which are so subtle and which are almost, the outcomes are almost invisible, are much harder to actually create and deliver. So these perhaps, and perhaps many more, are some of the reasons why social sector delivery becomes the most difficult of all services which the government or any other sector which engages in this activity will find. Now let me come to the second question. Why are PPPs uniquely suited to meet these challenges? Now, PPPs are a hybrid structure. They operate at the border of the public and the private sectors, and they bring fresh understandings of what we recognize as publicness and privateness. Now, these are just not an alternative structural model or a service delivery mechanism. They actually mandate that we change the way we do things. What we are traditionally or conventionally used to in creating an infrastructure or providing a service delivery has to necessarily change because of what the PPPs require in terms of their characteristics and their operations. Now, what are these kind of changes or the shifts which are required in service delivery? First, PPPs mandate that there is a shift of focus from project to process. Now, let us take an engineering project, for instance. What is the conventional way of creating or delivering this project? You just see that it is delivered within the certain time and cost constraints, and the project is completed. But PPPs mandate that we look at antecedents, consequences, because it is a whole of life cycle arrangement. So you look at the whole, the operation, the construction, the operations, and the entire process involved in the very structure of a public-private partnership. So it demands an approach which emphasizes the means, the stages, the preconditions, the antecedents, and the consequences of project completion and delivery. So this makes it peculiarly suited to long gestation projects. We saw that social infrastructure projects are are time consuming, and PPPs are uniquely suited because structurally they mandate that you look at a whole of life cycle operation. Second, PPPs require a second shift of focus from the firm. Normally, we look at an organization or an institution and see the functioning. The PPPs shift the attention from a firm or an organization to a partnership. Okay, how the partnership works mandates how successful the project itself is. Now, one of the excellent projects which we are doing in Karnataka today is the Akshaya Patra. Now it has been scaled up all over into several states of the country. It is a mammoth task to cook and provide hygienic, clean, and tasty food. And today, the website tells me that 1.4 million children in 10,000 schools across the country are being provided hygienic, clean food in a partnership model. And the way the partnership works mandates that the program is itself successful. Third, PPPs require a broadening of the very notion of governance. Because governance has generally meant that there is a government and it makes a policy, and then people within the government implement that policy. If they regulate, then people outside the government follow that regulation. But here we need a larger engagement with society and citizenry. Now I pointed out the example of the iron and folic acid which was distributed. Now when the health sector or the health department is merely distributing, then there's a possibility, and this is actually happening, that this supplement gets wasted. But if you are able to engage the larger community or the family into the process, then you can make it an educative and a joint effort whereby this is not wasted. And in fact, while discussing the HDR this year, we wanted to make that very change, that we have common facility centers where people are, the pregnant and lactating mothers are not only educated on the usefulness of supplements, but probably provided hygienic food. The second is that it should not, that is, only a certain program, certain components of a program can be tasked over to the private sector. Normally, when the public and the private partner interact, the government and the social or a corporate entity interact, government tries to task over the entire component. That is the most convenient from our point of view. Give over the whole program and let it be a turnkey project, and then you take the accounts or the completion of the project. But in this kind of a project, you cannot do that at all. There needs to be an integral and continuous interaction between the government and the NGO or the non-profit partner if this kind of program is to be successful. So you can't just task over the whole program, you can only give certain components. Now if you are looking at, let us say literacy program, then the awareness creation can come from the NGO sector, but the provision of teachers has necessarily to come from the government sector. So you can't say that I'll just hand over the program and then wait for things to happen. From the private sector side or the NGO sector side, the most important thing is the realization that there is a strong accountability mechanism within the government. We are answerable under RTI to the courts, to the C&AG. So it is necessary that that strong sense of financial accountability enters into the social sector organizations which participate in any kind of partnership program with the government. So if that is done, then most of the other things can be ironed out. So what I would suggest, that even if it is inconvenient, any kind of partnership between the public and the private sector should take into account the advantages as well as the pain spots. And there should be integral and continuous interaction between the two partners in any kind of social sector endeavor. With this, I would like to close my few words.
My name is Subho Hegde. I run a NGO called Kaushalya Vikas Kendra. This is the skill development for the school and college dropouts. I have a good experience of this PPP model. I worked for Bosch for long years and retired about 2.5 years back. When I was in Bosch, when we used to interact with the industry secretary and the labor secretary, often they would tell, Bosch is known for the vocational training. Why not you do something to help improve our ITIs? Because there was a refrain that the students of ITI coming out of ITI are not getting jobs. That quality has to be improved and all that. So I sent our training manager to local ITI to find out how we can help the ITIs. They came back and said that immediately what they need is the training in running a CNC machine, because the central government had given 2 CNC machines which are not even opened for 2 years because the faculty didn't know how to run them. So how do they teach the students? So we conducted a training program for the faculty to understand how to run a CNC machine, and they were all very happy. And after 1 year, I went to see what's happening. Those 2 machines which were given to them for earlier 2 years, they are still there, not even opened. And all the training what we had provided, it was simply going waste. So there is a lack of accountability there, and this was the case. In fact, we also did a program to train the faculty of about 10-12 ITIs in Karnataka, but the results are again not very helpful. Then one more suggestion came from the labor secretaries. Now the need is for the vocational training which are short term and meant for the school and college dropouts, which can quickly make them employable with little soft skills. Why not Bosch do it? I tried to sell this idea to the Bosch directors. They said, no, our main business is making fuel components or the automobile components and not CSR. Okay. Then I thought, then the ITS were not capable of doing that because it was clear that they were not delivering. So I thought this is what I should do after retirement. That's how this Kaushalya Vikas Kendra was born. But in spite of all the encouragement from the government, no help is really coming. If the PPP model is failing, in my opinion, in the social sector, it's not because of the social entrepreneurs. We all start these enterprises because we have a passion to give back something to the society. Now, there is something, of course, I'm not deterred by the lack of support. I have enough friends in the industry who support this with funding and other placement and things like this. But the real problem is the government has failed in running this in a PPP model. ITI is one example, and the fact is so startling. In spite of we would ask our vendors, why not you take the ITIs for for your shop floor mechanics? They said, first of all, they won't have any practical training. We have to train them again, one. And secondly, because they are ITI certificate holders, their expectations are very high. They expect at least 15 to 20,000 rupees salary. Whereas if I pick up a guy who is SSLC failed and I train him 1 month on my shop floor, I can expect a better performance from him with half the salary. This is where the disconnect is there between the ITIs and the small and medium scale industries, who are actually the employers. Now, this is something which, when we told the vendors, this is the reply we got. So there is a need for the private entrepreneurs to provide these short-term skills, and in a way that they are employable. For example, we make spoken English a mandatory learning for even for an electrician course. That's how they become attractive to the employers. So this is the model which will work in spite of not getting grants from the government, because the industry wants to support it. I think where the problem lies is the government should get away from this this kind of in spite of this. The problem is, last year the Karnataka government announced 100 more ITIs. In fact, the training commissioner was sharing with me, I don't have enough staff and the infrastructure to run the 168 existing ITIs. Now government wants me to open 100 more ITIs. It's clear it's a political decision, not based on a social objective. So this is where the disconnect lies, in my opinion. And I think the PPP model has to work, but with government withdrawing from its participation and just encouraging. Sorry, I took a long time.
I didn't get the question though.
Okay, the question is, if there is a impression that the PPP model with the social entrepreneurs, is failing, that's totally wrong. My impression is that it is the other way around.
That was not my opinion. That was the opinion of social entrepreneurs, which I took some delight, evil delight in repeating. But see, PPP is not the only way to go. I would hardly say that. There are programs which will be PDS, for example, which I am administering now. The public distribution system is a safety net program where I would feel by and large it should be the government's and the government's operational challenge alone. I'll be quite happy if people come, social entrepreneurs come into the system. But the very nature of the program is that it is better that the government operates it. But there are programs like skill development, for the program which you were talking about, artisan training and funding, which can be done. But that's not the only way to go. Where social entrepreneurs do it on their own, fair, well and good. I happen to feel that what happens in any kind of non-profit initiative which is standalone, as long as it is one initiative, it will work. The moment you try to scale it up and you want to cover, let us say, a much larger population or the entire state or the entire country, then it becomes difficult and then the regulatory challenge arises. I agree with most of the other things that you spoke about, that we do have significant challenges in merely Sarkari run programs. It's not what you were speaking of the CNC mission. Even I've seen it on much smaller scale in schools. In schools, long ago, about 15 years ago, we used to distribute under Operation Blackboard. We used to distribute a number of teaching learning materials, we call it. That would be the slate, the blackboard, and toys. And all of these were selected with a lot of care. At that time, I was a very young officer. I was a young mother as well. So I was, very much interested in giving very good quality products, which the children will enjoy. And then we distributed these to all the schools. At that time, I was working in Dharwad district. And then, when on my rounds, when I went around, I found that none of these were being used because the teachers were so afraid. This is not, that it was difficult to use as in the case of the CNC mission. This was just that the teachers had such a strong sense of accountability, financial or product accountability, that they were afraid it will get damaged. So they, just keep it locked up. And when we went for what they used to call inspection, they used to open and diligently show us. They did not realize that, and then I said that I don't mind if it gets broken or damaged, just let the children use it. So this can happen. There was also a counter example where, I used to find a lot, things are damaged in schools, things are lying around. But once when I went, there was a school which was locked. So I wanted to go inside the school. It was about 6 o'clock in the evening. School was over and the school was locked. So I said, I just want to go inside and see the school. So my executive officer who was with me, he was about to break open that lock of the school so that I could go inside. A small lock was there. Immediately, the people around came running and said, please don't break open the lock. We'll bring somebody is having that key, we'll bring that person in if you can wait. So we waited and they came and opened and then we were able to see the school. Then I asked, why are you? Because around the school there was garbage, plastic bottles lying, everything, but they were so careful about the lock. Then they told me that we all contributed 1 rupee for buying that lock. And so we don't want that broken. So this is also another instance where, if you don't have the sense of belonging, then you don't care what happens. But that lock was precious because there was some thing. So I am fine with all models actually. You were going to say something.
Yeah, just a small request. If you can please keep your questions short and concise, all of you. We'll have a question from there and then.
No, I don't think you should really put because there will be so much sharing of experience which comes. So don't put those restrictions.
Excuse me, sir has a question.
Here or there? Yeah.
My name is Pankaj. Hi. Thanks so much for actually very insightful analytical observation. I think there's a lot of analysis implicit in the observation that you make. So thanks a lot for that. Now, taking that into account, you mentioned very important thing that in the social developments, in the social sector, outcomes comes after a very long time and they are difficult to measure. And one of the implicit solution that you have suggested, that there has to be focused not only outcome but also the process and the monitoring. Then you also said that in terms of partnerships, there, like certain thing has to be done by the government and so on and so forth. I think both things are important point to take it forward, the possibility of working together. But unless the accountability is for the outcome, having a financial accountability doesn't really take us very far in the area of social sector. So the crux of the matter, I think, still not get addressed by just focusing on the process, because process, first of all, they take so long, and if the outcome is going to be after 10 years, how does one do this? So how does one crack this problem of performance accountability in the social sectors, where the outcomes in fact are on one case difficult to measure, and second case they come after a long uh, gestation period. So what's your sort of response
I
on those
really
two
see
aspects?
how we have an Annabhagya scheme, for instance. Okay, in Karnataka, I'm implementing what we call the Annabhagya scheme. Under Annabhagya, we are giving free rice, free rations, so to say, to all below poverty line families. In fact, we give to little more than below poverty line families also. We cover more than the number we have. But what is the impact in terms of health and nutrition? How are we going to see? It's an outcome based review, which is what I want to do now. In fact, it should take into account the implementation of the program over a period of 5 years or more, and then the impact on, or an independent assessment of improvement in health and nutrition levels done by a team of medical experts, so to say, and then look at whether how much of this is owing to general factors or social factors, and how much of it is due to the program per se. Okay, it is not impossible to do, but from the government side, this is the issue is that we plan annually. Okay, we plan by way of a financial year. So this larger issue of looking at an outcome based measurement, structurally we can still put it. We have an organization called the Karnataka Evaluation Authority, which is equipped to do this, because it is actually manned by people from academia and researchers. So it's not so difficult to do, but it can still be done. But that should take an independent trajectory, which is separate from the financial year planning. Okay, but all this does not obviate the necessity for financial accountability. Okay, the thing is that these are realities, and when I speak to people from the social sector, they are contemptuous of this. But for me, not just me, but especially my subordinate levels who are in fact facing the heat, financial accountability is an extremely important thing. It is a reality, because their careers, whether their jobs, their pensions, etc., everything depends on that. So both are required. I do agree that in government we give a greater focus, because that is more immediate. Your C&AG is breathing down your neck, or the high court summons you and calls you on something. So we tend to give a greater focus. At higher levels, we do understand that there's a need for outcome based measurement, which is what we actually try to do. This whole exercise of bringing out annual human development, not annual but occasional human development reports, is actually an exercise in that direction. We use it then to make policy. So that something.
My name is Ullas. I work with this organization called Meghshala, and at Meghshala we work with schools, government schools mainly, to help teachers to teach better. And we've seen great results lately, and we started this program called the Meghshala Fellowship, where we provide a fellowship for a group of teachers so that they can teach really well in class. We've made it very aspirational, so adoption levels are great. Teachers are using it in class every day. All of those things are happening. From the BEO side, we are having great support. Every time we go and ask for a training program, permission is always given. No problems with that at all.
so that you can have a similar experience.
So all of these things are going right. So is this what you mean by a PPP? Because the one difference though that I still see is that we are always reporting to somebody, or we are not equal with the government when we are working. So is there a way? I mean, they respect us, we respect them. There's always that bonhomie there. But uh, is there a partnership or a legal thing or something where it's not only us giving, they are also giving it, but there's a certain accountability to they giving also. So is that can that be made part of a PPP, or is it only like a handshake?
You are being funded by the government? No, no. So then where lies the reporting, so to say?
The reporting is mainly when because the schools have to report to the BEO and all
Yes.
of those things. That's where their reporting comes in.
Yes.
So we don't have to report to the BEO, but he will obviously ask us how are things going, etc., etc. So we get back to him with updates and reports.
Yeah.
That's the partnership level that we have.
Okay.
But how do we take this to a PPP? And is there? I mean, does it look different? Is my question.
No, oh my. See, a PPP is not a hard and fast thing. Okay, in the economic infrastructure model, when you are constructing, say, the Bangalore airport using a PPP, there's a structural solidity to it. But not in the social sector. Any kind of loose partnership is also a PPP. In fact, this is what, if you are going to say that A, B, C, D characteristics are characterize a PPP, and this is what I'll call a PPP, then in the social sector you're not really going to succeed. I think it's going to be me and you, and whatever we work out between us. Okay, so I may decide that I'll give the funding and you'll train the teachers, or I may decide that you train the teachers, or both of us together. When I say that, you do everything, but I'll just keep asking you, which seems to be your model, as to what is going on. Now, if you are reporting, I don't even think that it should be called termed reporting, what you are doing, because you are merely giving a feedback to the BEO or the education officer as to what you are doing. I don't think you should even shirk from doing that. Please understand that for the running of the school and the educational outcomes of the students, he is responsible. And now, not that they're doing it very greatly. You can immediately confront me with that question that without us our learning outcomes going to be much better. No, that's not, it may not be so. In fact, much improvement might have been seen only with your intervention, but the responsibility is still his, and therefore his asking you for feedback, if it is not impolite or domineering in any way, I think you should just take it as a very nice and healthy partnership which you are having. Your real difficulty may come if you try to scale up, because everywhere you may not have the same cohort group of students or the same set of individuals who will be nice to you, so to say. Yeah, government agrees to fund us, you have an additional dimension of accountability which is rock solid, because then the whole financial accountability thing comes. You'll be much freer in the kind of model which you have adopted.
So we will have one last question. Yeah, please. That's the last.
You should also have an number cap per individual.
This is just a
This
quick
is the
question.
last session.
So this is just a quick question on the profit part in the public-private partnership. So I work in the healthcare sector, and I really want to initiate some PPP models in the healthcare segment. So we have a screening models for vision care and hearing screening of our people. Now we want to work with the government so that this can be initiated, but at the same time, we want to make this whole model sustainable. Sustainable in the sense, in the terms of business, like when you, for example, sell something through your model and you are selling it and making profit. For example, even it is a minimal profit of 50 rupees. We want to share that profit with the person who is providing the service and also make profit for the organization, which is minimal for our operational expenses. So how open are you in such kind of models where some money is being transacted at the level of let's say PHC.
Okay.
Sorry to cut in. Can I answer that? I'll tell you the reason. Hi, I'm Milind. I represent Chikitsak, and we are also a health screening company. We are screening the entire state of Karnataka, Andhra, and Chhattisgarh, starting off immediately. And we also have the same model of getting paid by the government and revenue share with the Asha worker, all the Vaidya Mitras. And we use technology, so the accountability is completely transparent. Reports are generated at the end of the day, everything. So we also have a company which does impact assessment from day one, taking into consideration the lifestyle of individual who's getting screened, to the lifestyle of the ASHA worker, the regional health officer, the district health officer, and consolidating that as a report, which is then verified and reported. So that's the only reason
So it's a workable model, is that what you say?
absolutely.
Brass tacks wise, if this is the model which you project, and if you are able to get through the different layers in government, and it is upfront that this is, this is a percentage profit, or in terms of rupee terms, this is the amount of profit which will be structurally integrated into the project and then passed on both to you as promoter and to the other participants. It should not be a problem, because you do have instances in the hard infrastructure areas, electricity for instance, airports for instance, where private infrastructure is built, profits are earned. Okay, and that becomes part of the revenue stream. In social sector you may not have many such examples, okay, but there is no reason why it shouldn't get through. If at some point of time you get greedy and the profit seems to soar up, then probably you'll have troubles in interaction, but I'm just anticipating this. Otherwise there's no real reason. It should be upfront about it. Anything else? He probably will have a hands-on kind of experience in this kind of